Assalamu alaikum. Have you ever noticed a swelling or lump in your groin, around your belly button, or on your abdomen that becomes more noticeable when you cough, lift something heavy, or stand for a long time, but seems to disappear when you lie down? If yes, don't ignore it. It could be a hernia. Today, I'd like to explain what a hernia is, how to recognize it, and why seeking medical advice early is so important. A hernia occurs when there is a weakness in the muscles of the abdominal wall. Through this weak area, fatty tissue or part of the intestine can push outward, creating a visible or palpable bulge. A hernia can develop in anyone, men, women, and even children. The most common types occur in the groin, around the belly button, or at the site of a previous surgical incision. In the early stages, a hernia is often painless. Many people only notice a small lump that appears when they stand, cough, or strain, and disappears when they lie down. Because it doesn't cause much discomfort at first, many people delay seeing a doctor. However, a hernia usually does not heal on its own. Over time, it often becomes larger and may start causing pain, discomfort, a feeling of heaviness, or difficulty during daily activities such as walking, exercising, or lifting objects. Sometimes, a hernia can become a medical emergency. If the swelling suddenly becomes painful, hard, cannot be pushed back in, or is associated with severe abdominal pain, vomiting, or abdominal swelling, you should seek emergency medical care immediately. This may indicate that part of the intestine has become trapped and its blood supply is compromised, requiring urgent surgery. There are many myths about hernias. Some people believe that medicines, abdominal belts, or home remedies can cure them. Unfortunately, this is not true. While a belt may provide temporary support in selected situations, it does not repair the weakness in the abdominal wall. The only permanent treatment for a hernia is surgery. The good news is that modern hernia surgery is safe and highly effective. Many patients are suitable for laparoscopic or keyhole surgery, which involves small incisions, less postoperative pain, faster recovery, and an earlier return to normal activities. However, the most appropriate treatment depends on the type and size of the hernia and your overall health, so an assessment by a qualified surgeon is essential. If you have noticed a swelling that comes and goes, especially when coughing or lifting heavy objects, don't wait until it becomes painful or complicated. Early diagnosis and timely treatment can prevent serious complications and make recovery much easier. To learn more about hernia symptoms, causes, diagnosis, treatment options, and recovery, I invite you to visit Professor Dr. Zahid Mahmood's website, http://www.professorzahid.com. The website offers reliable, easy-to-understand information for the general public, as well as educational resources for medical students and healthcare professionals. You'll also find informative articles, videos, and practical guidance on many common surgical conditions. If you found this video helpful, please share it with your family, friends, and anyone who may benefit from learning about hernias. Thank you for watching. Stay informed, stay healthy, and remember, early diagnosis is the first step towards successful treatment. Allah Hafiz.